April, we are going to get an update on, what's happening in Imperial County as it refers to COVID-19, and also some other issues that are going on, not necessarily issues, but activities. And with us on the phone today, it's Imperial County Chief Executive Officer Tony Rouhotas, and with him is Chris Herring, the Emergency Services Coordinator for Imperial County. Good morning, Chris. Good morning, Tony.
Good morning, Carroll. Morning, Carroll.
Well, lots going on. Imperial County last week said, the county health officer said, okay, anybody over 16 that wants the coronavirus vaccine, line up, get it done. And that is happening, isn't it?
Yeah, that was great. So as of last week, anybody 16 and older could receive the Pfizer vaccine. And it just for the public's sake, Moderna is for 18 and over. However, if you are 16 and over, you can receive the Pfizer vaccine. Again, that's a 2-dose vaccine, and they were made eligible last week. One of the other things is Johnson & Johnson was put on hold nationwide due to some concerns. Well, that's being overlooked. Still, though, if you're 16, you're not allowed to receive the Johnson & Johnson. That's for 18 and older as well.
Okay. And we have learned the best way to find out where you can get a vaccine is vaccinefinder.org.
That's correct. Vaccinefinder.org. That'll tell you where your nearest location is, the availability. I can tell you there's a clinic going on this morning in Kxo. Pioneers Healthcare Memorial District is doing that. They've been a great partner. They set up a mobile trailer where they've been going around setting up vaccine clinics and just doing a really great job in partnership with the health department. There's a lot of coordination going on. They've done several of the remote areas. They've done several of the farm community large-scale operations. So it's just been a true asset to see them deployed and getting those vaccinations out there.
Well, I know Pioneers, El Centro Regional, Clínicas de Salud, and a number of other clinics, physicians' offices have been very active in getting the vaccine out, as have been retail pharmacies. That's
correct. So the map, when Jeanette started, shows little stars and just really it's expanded across the entire county. Which shows a lot of true partnership there. Also, another great partner, as you mentioned, El Centro Regional, Clínicas de Salud, Carroll Valley Medical Group, Family Medical Group, a couple local pharmacies are doing a great job. The other team that's been doing a lot of work is our nursing students at IVC did quite a bit, but as well as the National Guard. The National Guard's been a great partner. Adding that personnel and being part of the rotation and getting out there and helping us get it done.
Well, and that is one of the things we mentioned last week. Imperial County really got it together, and a lot of it has to do with the fact that, okay, we've done this. We know how to set up mass vaccination clinics, and we're able to do it. And politics moved aside, and people came together, as they do in the Valley, and got it out. Looking at the numbers as of yesterday morning, over 83,000 doses of the vaccine have been administered, 34,000 people fully vaccinated. And that's significant. I don't know, haven't really checked too close on the numbers, if any other county is putting up numbers like that.
Hey, Carroll, this is Chris. I wish I could say I've checked the other counties, but we've been too busy focusing on ours. But I know the progress we're making is really good. Tony talked a lot about the partners we've been working with for the last few months, the last 4 months of this, vaccination campaign. I think when this is over, we might just have to book like 3 hours with you just to read through a list of names and agencies. But yeah, I mean, it's been a tremendous amount of work. We've had a tremendous amount of support from all of our partners, and it's been really great to see the community showing up and turning up to be vaccinated to help get through this pandemic. And just a little anecdotal comment: you figure those 83,000 doses, each one of those is about 15 to 20 minutes worth of time in a very efficient clinic. So just extrapolate the man hours that all of our healthcare providers and partners have been putting in to protect this community.
Okay, and Tony mentioned the Johnson & Johnson vaccine is, I think the term CDC used was paused while they're doing some studies. Is that going to affect the local vaccination sites?
So it'll have a little bit of an impact on us. We were receiving Johnson & Johnson, and the Johnson & Johnson allocations were a little sporadic. Sometimes it would be 2,000 doses for the week. Sometimes it would only be 100 or 200 doses for the week. But we are able to adjust with the Moderna and Pfizer allocations to kind of cover those gaps until we get some more clarity on the Johnson & Johnson.
I think Chris is being a little modest here. So when we got the news of the Johnson & Johnson, Public Health did a great job on shuffling some stuff around because we did have a couple larger scale clinics, anywhere between 500 to 1,000 people that would be inoculated. And we had set aside Johnson & Johnson for that. However, when we got news of the Johnson & Johnson, they did made some magic math happen and did some moving around of vaccines and made sure that the vaccine clinics were made whole either by getting Pfizer or Moderna to them. So we did not cancel any. We might have had to adjust some numbers or adjust some appointments. However, there was no cancellation.
And with the Johnson & Johnson, it is the single shot. The Moderna and the Pfizer are two shots. So that may logistically, if a clinic had been scheduled with Johnson & Johnson, they got to schedule a second clinic in 3 or 4 weeks.
That's correct. So that's just some of the logistic stuff. And that's why I said they're being a little modest, because when you do have to make those little tweaks on our side, it also doubles the work as well. However, when I've personally been asked which vaccine to get, what vaccine should I take, my take is get the first one available to you. Logistically, some people want to be one and done, and I understand that. And on the operational side, it's a lot easier for the one and done. However, we don't want to hold back. The other one's available. Even with one shot, the efficacy is still there. And on both shots, there is a 3-week or a 4-week delay in between the second shot for the increased efficacy. However, the whole root of what we're trying to achieve here is to keep people out of the hospital. And being that our hospital numbers and our ICU numbers are extremely low right now, that's obviously what these guys are doing out there in the field is paying off and being effective.
Well, that's one of the things that I have been tracking is the number of hospitalizations, and significantly lower. So things are working. The hospitalizations have dropped. I think the numbers that we had as of yesterday were like 8 COVID patients hospitalized. And those that are hospitalized, well, we don't have I don't have the numbers as to age and comorbidities, but that plays a big part in the hospitalizations. And I know, and Chris, I'm not sure, are they still operating the infusion therapy at El Centro Regional?
Yeah, actually, both of our hospitals still have access and are administering I'm not going to even try and pronounce them on the air live with you, but they are still doing the infusion therapies at both hospitals. It is available to the community, and that's part of the whole big picture of fighting this pandemic. If we go back a year ago, we were just starting off. It was a new disease. It was a new virus. We didn't know a lot about it. But through the year, there's been a lot of great work done to find better ways to not only prevent, the spread of the virus, but treat the people who become ill. So we do see an impact of the medical research that's been done in decreasing the severity of the illness, the length of hospital stay, and all of that kind of works to our favor to be able to keep our hospitals fully functional, to be able to care for not just COVID patients, but care for our stroke patients, our heart attack patients, and everything else that happens in life.
And they appear to be well in that zone as, okay, I don't have any idea what normal is, but their operations are far more near normal than they were as recently as 3 months ago.
Yeah, that's correct. And in your defense, I don't know what normal is anymore either after the year we've had, but I know we're a lot closer to where we were. We do still want to prepare our community. As our hospital numbers are staying pretty stable, but our case rates and some of our other metrics that we've been watching that have been early indicators before are starting to increase a little bit. So the case rates, the testing positivity. But like I was saying, that severity of illness seems to be on the lower end at this point. But in an effort to continue preparing our community, we're working with the state to, much like we've done before with building out of hospital capacity in a preparedness fashion. So you may start seeing some of the tent structures again in the coming days and weeks. But ultimately what we're looking at is, because of all of the other therapies that we have in place and because of the tremendous amount of vaccination that's taken place in our community, that severity of illness seems to be a lot lower this time than we have seen previously.
Exactly. Okay, Tony, a couple of questions for you. Crisis at the border. And, hey, we're on the border. And once again, Imperial County has stepped up. Imperial County housing some families. Actually, the state, I know, is housing them, but they are here in Imperial County, several local hotels. And what's going on with the alternate care site at Imperial Valley College?
Yes, you never know what a crisis is until you actually have a crisis within a crisis, right? So
I'd have to look that one up.
So you're absolutely right. You've seen this nationwide, and it's also impacting Imperial County as we are a border community. So the state has been called in to work directly with the feds. Early on, we were having discussions with the federal government and realized we definitely needed to partner up with the state. So the state has sent resources down here specifically to DHSS to help provide services to the migrant flow that's entering into Imperial County, as well as other places. So there is an intake, evaluation, and I don't know if you want to say distribution center, where the people are coming in, whether they have a family that they're reporting to or a location they're being sent to. All that's being coordinated. There is a couple locations that's been in the media. Of course, the Barberworth Country Club is one of the sites, as well as a hotel in the city of El Centro, where these places they're coming to. They're meeting with the Department of Social Services. They're receiving instructions on where to go from there, and transportation documents and housing. So that is occurring. The county is not in oversight capacity, but working with the state and doing what we need to do on our side. But however, the state is running the actual operation. As far as the alternate care site, I'll let Chris speak on where we are currently with that. It was housed at IVC, but there is some transitions taking place.
Yeah, so the alternate care site and all that was out at Imperial Valley College in the gym, and I'll kind of start the conversation by just, again, I don't know if we can ever thank them enough, but IVC has been a tremendous partner over the past year. They provided that facility, and they've been working with us, essentially every day for the last year. With the college, they do have some construction projects even that they delayed for about a year for us, so we could continue caring for patients in their gym. So they are working to have that facility up and running and ready for students and basketball games in the fall. So we are moving our location for our alternate care site to the Ivy Expo, to the county fairgrounds. That site is being set up by the state. Again, it's at this point, it's just going to be the equipment and supplies. We're not opening the alternate care site. They're not staffing it. We're just in that preparedness fashion, moving to have things ready. So if we do need it, it's available to us quickly. And that's another great partner. We talk about disasters, and everything is, partnerships and communication. And I think, this past year has really highlighted the importance of that. So you'll start seeing some activity out at the Ivy Expo as well. Again, that's just a backup alternate care site for us if our hospitals need the extra capacity. But IVC provided their facility for just about a year through all the partnerships that we had. We treated just about 600 patients, spent some time in that college gym receiving medical care. And I'll tell you, aside from a few logistical hiccups here and there, the feedback that we received from the patients that were treated there was for the most part, very positive.
And getting a positive feedback from somebody that has been ill and obviously not doing well, that's a good thing.
It is.
Okay. Tony, anything else exciting going on around the Imperial Valley?
We just have a little bit of exciting office news. I know you posted it yesterday. Appreciate that. We do have a new public information officer, Mr. Gil Rebelar. Has been offered the position and accepted. Gil has been a great asset during this whole COVID response. He was already a county employee working over our Air Pollution Control District. However, during the transition, he was brought on as part of the Joint Information Center. He's produced a lot of videos, a lot of the stuff, social media, a lot of the updates for the occurrences and just happenings on COVID and other matters. So he's already hit the ground running and is a true asset. He's really good at putting things together as far as videos and recordings. In fact, he's in the other room right now videoing the weekly update with a couple board members. So just super proud of him and to have him on the team here. And he should be a great liaison, not just with you, but all the local media.
Okay, information. It is vital.
Very vital. Thank you.
Okay, guys, we appreciate the visit today. And, patronize your favorite restaurant this weekend, 50% indoor capacity. Or if you're like me and you feel more comfortable on the patio, go ahead.
I agree with you on that one. Let's support our local community as much as possible.
Okay. Chris, you have a great weekend. Tony, you the same.
Pleasure, buddy. Thank you. Bye.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.